Bernadette Baligod, and today I will going to perform the Peripheral Vascular Assessment. So first is introduce yourself, verify the client's identity, explain to the client what are you going to do, why it is necessary, and how the client can cooperate. So hi, I'm Bernadette Baligod, the student nurse from Tarlac State University. So may I know your name? Okay, Mr. Bautista, today I will going to inspect and palpate you to identify or determine if there have an abnormalities. So, this is helps to alleviate anxiety, promote cooperation, and facilitate examination. So the patient's identity ensure that the assessment will be performed into the right patient. So perform hand hygiene. Next is perform hand hygiene and observe other appropriate infection control procedure. So I'm going to use an alcohol. So this is to prevent the spreading of microorganisms. And then next is we're going to assemble all the equipment needed. So first we have the cotton balls, the stethoscope, then the cotton balls with alcohol to disinfect the stethoscope, pair of gloves, ruler, and then the flat surface. This is saves time and energy. So next is I'm going to provide the client's privacy, of course, by closing the door and the curtains. And then next is determine the client's history. So, hi sir. So, masakit ba dito? So, it is legs pain or cramps. Then the second, the skin color of the arms and hand. So, as I observe, arms and legs. So, as I observe, I don't have observed any abnormal color. So, I don't observe cyanosis, pallor, or jaundice. So, next is I'm going to then the swelling, lymph nodes enlargement, and the medication. So, this is serves further references. So, next I'm going to position the patient into the supine position. So, with the head elevated at 45 degrees. So, this is promotes comfort and also accessibility. And then next I'm going to inspect. So first is the arm size, the venous pattern, and look for an edema. So into the arm size, it is a bilateral and also bilateral symmetric, and also a minimal variation of the size and shape. So in the coloration of the arms and hand, so it is a depending on this client's skin tone, or it is should be same bilateral. Okay. And then next is I'm going to inspect and palpate the patient. So into the arms, fingers, and into the hands. So first is I'm going to inspect the color. So it should be a pink or red tones visible into the dark pigmentation. So it is also bilateral. So and also into the temperature. So with our fingers we can identify the client's temperature. Or into the using the thermometer. So into the temperature, it is a warm, so it is a normal. So next is the going to use a gloves. So next is we will going to identify the sensation, so scatter stimuli into the patient's into the while the patient is closed eye. Okay, close your pikit mo yung mata mo. Okay. Nararamdaman ko. Ito. clients can identify the light and the deep touch. And then next is we will going into the mobility and the capillary refill time. So in capillary refill time, it should be usually less than 2 seconds. So note for the inaccurate results. So when the room is cool, when the patient has an edema, anemia, or recently smoking. So I will going to hold the hand at the higher level of the heart. So and then press the soft pad or the fingernails until it turns into the white. So take note of also the time needed for the color. Okay. So when I press the patient's fingernails, it is immediately back to normal. And then next is I'm going to um, palpate the radial pulse. So in the radial pulse, so it is with the place our fingers into the uh, pads of our fingers into the flexor surface with the into the wrist by laterally. So take note also for the intensity of the pulse. So it is a strong and equal, so it is a normal. So and then the ulnar pulses. So it is into the other side of the wrist. So it is also okay. It is also bilateral strong and equal. And then the brachial. So it is into the medial outer medial part of the upper near the elbow. And then next is the carotid, palpate the carotid artery. So with the gently tilt head to relax the sternocleidomastoid muscle, I will place my fingers into the between the sternocleidomastoid muscle and the trachea at the level of the cricoid cartilage. So the pulsation, it should be a 60 to 90 beats per minute. It is a regular, strong, equal, and elastic. And then next is I will going to auscultate the carotid artery. So I will going to use a stethoscope. So I will place the bell of the stethoscope into the carotid artery while the patient's breath hold breath. Okay, no sounds heard, so it means it is a normal. So I will going to inspect the jugular veins. So into the jugular veins, with the head elevated 45 degrees, with head elevated at 45 degrees. So identify the point of the venous weight relation into the sternal angle with the inches and the centimeters. So while I inspect, so it is also by typically it also a in the jugular veins. So the pulsation height is 1 inch or 3 centimeters. And then next is I'm going to inspect the legs. So we will going to into the patient's legs. So in the patient's legs, so inspect also for the color. It should be a pink or red that tone that visible into the dark pigmentation. And then also the temperature is warm. Okay. And then the mobility, and then this sensation. So this scanner stimuli with the patient closed eye. So okay, close your eye. Nararamdaman mo ito? Ito. So the clients can identify the light and deep touch. And then also what we call this, the superficial veins. So the superficial veins, it is a we call superficial veins. It is a small venous uh, distension with standing that causes in elevation. And then the condition of the skin, it is intact. And then the edema, so it not present. And then we're going into the palpate the femoral pulse. So in femoral pulse, so cover the genitalia with a sheet or slight abducti, and press deeply into the inguinal ligament and the medial and um, the symphysis pubis and the anterior superior iliac spine. And then use fingers to feel the femoral pulse. So it is also bilateral, strong, and equal. So next is we are going into the popliteal. So in popliteal, with the bend knees, okay, bend knees, no? With the patient bend knees, so we will going flex the legs at 90 degrees, and then I will going to uh, and then we will going to press it. So it is a strong and equal bilateral. So but not usual into the popliteal pulse to difficult or what we call this impossible to detect. And then we will proceed into the posterior tibial pulse. In the posterior tibial pulse, so it is into the side of the ankle. So use two or more fingers to palpate it. So after that, it is a bilateral, strong, and equal also. And then we going to the uh, dorsalis pedis. So in the patient is into the dorsiflex or extend the foot. So we're going to use two or more fingers also. Slide slide the skin lightly against the skin. Okay, and also it is bilateral, strong, and equal. And then we will going to document. So we will going to document if there have an abnormalities that we finds into the patient. So this is basis um, of the accurate reflection of the nursing assessment for the changes of the clinical state and the patient pertinent information. So that's all for the peripheral vascular assessment.